States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Roll call. Right?
Sure.
Councilman O'Flaherty.
Present.
Councilman Castillo.
Here.
Councilman Fazio.
Here.
Councilman Hoppenstedt.
Here.
And Supervisor Lembo.
Present. Okay, this time we have two public hearings. I'm going to make a motion to extend written comments to 8/5 for the building codes. So we're waiting to get some information back.
I'll second it.
Any discussion
Nope.
on the vote? Aye. Okay, at this time, the other public hearing will be establishing an ambulance district. So we have everybody here from Ulster County. So what we want you to do is, once you're recognized, state your name, and you'll have 5 minutes to address your questions. So who's going to lead off?
I'll make a motion, we open the public hearing.
Oh, I'm sorry, okay, second it. On vote?
Aye.
Aye, okay, now we'll go. So who's gonna,
I mean, I don't know if there's public comment. I could speak, I don't know if specifically if there's anything you want me to speak to.
well, I think you should explain this to the public.
Okay.
And then if there's questions, then
Absolutely.
you guys can answer the questions, because,
Okay. Yeah, so I mean, it's being proposed by the.
Excuse me, can you stand up?
Sure,
and,
not a problem.
yeah,
This way, you introduce yourself to the public.
My name is Everett Erickson. I'm the Commissioner of Emergency Services for Ulster County. With me here, we have Terry Hennigan from the Hennigan Law Firm, who represents Ulster County in regards to EMS functions. Also with me, I have the Director of the Division of EMS for my department, Rich Miller, and Assistant EMS Coordinator, Michael Beninati. We've been looking at data throughout the county for many years now regarding EMS. And we've had a real hot spot where there's been lack of response or a long response time, extended response time in the southern tier, including the town of Gardner and the town of Plattekill as a whole. Understanding that there's different fire districts in the town, right? So you have the Modena Fire District, you have the Plattekill Fire District, then you have the Clintondale Fire District that covers a portion of the town as well as a portion of the town of Lloyd. So please understand that as well. We've had these extended response times to the point that it's become inadequate, right, for the public to wait for EMS. I mean, we're seeing 20 plus minutes. There's times that we've seen hour waits. The 911 center is going second, third, fourth, fifth, sixth dispatch, right, to try to find an ambulance. So that needs to be addressed. When it comes to volunteering in the EMS side of the house, it's becoming very hard to find volunteer EMTs. The ranks are slowly dwindling over time. And the thought process here was that, we proposed, and we've been doing this very successfully with the Modena Fire District and the Clintondale Fire District since January 1, because both districts came to us and said, we're having a lot of trouble. The Modena Fire District, we're having trouble covering calls. We've identified this. We want to work with you to try to address this problem. The Clintondale Fire District has no EMS coverage. It's actually one of the small portion of the town, of the county, that doesn't have an ambulance service at all, right? Today's day and age, pretty much unacceptable. So what they said to us is like, how can you help us, right? So what we did was we did a year contract with those two fire districts to provide the services. But bigger picture, how do we address this? And we've been working great with the Plattekill Fire District as well. Okay, Chief Foster has been part of the conversations and wants to be involved in this, whatever we decide, can be done here collectively, whatever the board decides and what the county can do, or whoever they decide to work with, right? So the county has been assisting municipalities create EMS districts. We just did this in the town of Gardner last year, creating an EMS district. We subcontracted out to New Paltz Rescue for the town of Gardner, and it's more of a shared services model, right? We're covering Gardner, the town of Lloyd, and the town of New Paltz collectively together, and we're sharing the resources, right? Because what does that do? That gives elasticity to the system, which, if you look at this just as one town or one area alone, you have limited elasticity. EMS is expensive, okay? On average, an ambulance is going to cost you 24/7, 365 without looking at reimbursements. You're looking at about $1.2, $1.3 million, right? And then when that ambulance goes on a call, you don't have another ambulance to back it up unless you're paying another $1.3 million for that second ambulance to be there for you, right? So, the idea is that we create elasticity through shared services, right? We can do that if the town so chose to contract with the county. We can offer that elasticity, right? We can bring you into that coverage area that we've created and share the ambulance services, right, amongst all those towns. The proof is in the pudding. We've had great success with this model so far. I can tell you that in March of this year, there was a really bad fire in the town of Lloyd, right? It was a fatality, but there was 3 patients. And within a short period of time, we had 3 ambulances on scene, okay, ALS. That is crucial to survivability of anybody that's injured, right? So those are the things that, that we're looking at. I don't know, regard operation-wise, Rich or Michael, if I've missed anything that you feel that needs to be added. I can let Mr. Hannigan kind of speak a little bit more about the formation of the district and the plan that was put together.
Do you want to just mention BLS, ALS?
Yeah, and there's a difference between services too, right? We have advanced life support, we have basic life support. When I say $1.3 million, that's advanced life support. It's going to be less for basic life support. Currently, the Platicille Fire District offers basic life support. The Modena Fire District offers basic life support. The Clintondale Fire District offers BLSFR, right? They're going to, an EMS call goes out, they'll respond with the firefighters, but they can't transfer you to the hospital, right? So that's what that happens. Modena has 1 ambulance available to their within their department, and Platicille has 2, right? So I think that covers that.
I'll try and run with this a little bit. For those of you that don't know, the distinction between BLS and ALS is basically ALS, Advanced Life Supports, our paramedic personnel ambulances, and they can do more intensive drug interventions and IVs and other medical interventions that a basic EMT cannot do. By way of background, just briefly, I was an EMT for 47 years. I worked my way through law school, driving an ambulance up in Albany. And I'm a volunteer firefighter. I've been a volunteer for God knows how longer than that. So, so I know a little bit about delivering the service. What you have here, what is being proposed here, is the establishment of an ambulance district, which is not like a fire district. It's kind of its own autonomous little thing, but it's more like a lighting district. If you pay for street lights in parts of your town, that's what you have. But what we're doing is taking the town of Platicille as a whole and creating both a geographic area that already exists, turning it into a taxing area for purposes of providing revenue to support this comprehensive ambulance service that Everett just spoke to. Again, right now it's kind of, or up until last year, it was kind of balkanized. It was kind of autonomous with respect to the fire district. You were getting different levels of service and volunteer-based service. Going forward, it's not going to be, obviously not volunteer-based service. It's going to be paid career personnel who are providing the service. The volunteer ambulance model just really doesn't work in most places, including Ulster County, with the demands that exist. I'm a volunteer firefighter. I bleed volunteerism, okay? But I don't want to live in a place that has a volunteer ambulance because I know the demands that are on it. I've counseled clients that have gone through that. I had a small squad where there's 3 people essentially, and they had to coordinate when they could leave town or go shopping because they didn't want to leave their town unprotected. So I know what the demands are on the volunteers. This is not to denigrate them. This is to relieve them of the burden that a lot of them are carrying as volunteers because they can't make all the calls, and they know that. So the ambulance delivery service has evolved over the years, and in order to have a competent system, competent meaning one that when you need it, you get an ambulance, it's going to cost money. All right, now, it's nice to think of these, Wayne and wax nostalgically, but it's not that way anymore. It's not the guys in the white suits coming to with the Cadillac ambulance. That doesn't exist anymore. There's even great demand on the paid side, getting enough competent and trained paramedics and EMTs. There's really a push there. So the volunteerism is going away, and in order to assure that you have the level of service that I think that you expect, and certainly that you deserve, and that the people in this room want you to have, it's going to cost money. And what's the best way to do it? It's one of the best models is to do it on a town-wide basis. Everybody in the town pays the same proportionate to their tax, to the taxable assessment, and the system that's been created through the county and with the cooperation of the local providers, the fire districts and the volunteers coming to the county and saying, hey, we got this problem, is that the county will coordinate for this. It will provide the coverage and the backup coverage. It will contract with agencies to provide that coverage, and you'll have a level of service that, quite frankly, you haven't had up to this point in time, but that will take you comfortably into the future and ensure that people won't be waiting, several minutes, for ambulances, and that if there is a high demand in one area, that there's backfilling and there's an ability to compensate for that. So it's really more about coordination and the effective delivery of ambulance and EMS services. It costs money. It costs money where I live. Okay, but we got away from the volunteer side and the ambulance services about 15 years ago and haven't looked back. It's and I kind of euphemistically say you may not want to pay for an ambulance now, but what would you be willing to pay when you're having that tightness in your chest? Okay, what's it worth to you to have somebody there in 8 minutes as opposed to you hear the tones going out? And again, it's never fun to say, okay, we're going to create this system and it's going to cost taxpayers money. It's inevitable. That's the way it has to be, and it's basically a byproduct of what the EMS providers, the volunteer EMS providers, are telling us. They can't do it anymore. They can't do it consistently anymore, and you need to morph the system so that it provides for a comprehensive, redundant system with essentially paid personnel to provide that service for you. So, my job was to work with the town to set up the mechanism by which you do this. It's called an ambulance district. It's a taxing district. There would be a separate line item on the tax bill that you get when you go to the mailbox on January 2nd. It will be a line item for ambulance EMS. And based upon the numbers we have of what it's going to cost and what the county has to charge to make all this work, it's going to be about $650,000 a year in the tax levy, which works out to about 98 cents a thousand. So if you want to do rough math, which is the only kind of math I do, it's $100 per $100,000 of assessed valuation. That's a little bit less than that, but that's rough numbers. So that's what we've come up with. Those and that computation is really driven by the cost of what it's going to cost to do this. But Everett and his group they've got some experience under their belts with respect to running the system for a while, and they've got some pretty good data in order to demonstrate what their contemplated costs are going to be, what the revenue should be on the other side of the equation, and ideally this will come in, if not not exactly on our numbers, but a little bit one way higher or one way lower, but not too far off that estimated value. And again, a tax rate of 98 cents, or roughly $100 for 100,000.
That's gonna be spread just between the ambulance district here and the whole county.
It'd be the town, just the town of Plattekill.
So we're absorbing the cost.
You're absorbing the cost for your town, right? So you need to look at this as, the town of Plattekill is buying into the system. These ambulances that we're talking about are shared ambulances would be shared ambulances for Plattekill, Lloyd, Gardner, and New Paltz, right?
Excuse me a minute. What was your name for the record, please?
Roy Terwilliger.
Thank you.
So you're looking at these ambulances being shared amongst those towns. These aren't county resources for the county. You're contracting with the county to provide you the service, right? And it's gonna be those townships that are bought into it. If more townships wanted to buy into this system, right, we could do that, right? We would add more units because it's all based off of call volume, right? We're looking at data, we're using data to make these decisions, right? We're looking at response times, we're looking at on-task time for them going from your home to the hospital and getting back into the area. How long does it take to move an ambulance around, right? So if an ambulance goes on a call in the town of Plattekill, right, we're gonna take an ambulance from, Gardner or New Paltz and start to move it around, so it's closer if a second call drops.
You and I know
Yep.
each other, so I understand what you're saying.
I wanna make sure everyone understands, just based off your question, so.
I just need, because everybody wants an ambulance here.
Yep.
We need one, everybody knows that. Okay, my concern is how it's gonna be funded and who's paying for it.
Yeah.
Okay, when I hear a district, that means we're paying for it.
Yes, your district is paying into the system. So I look at it as the town of Plattekill, I look at it as one system, right? I'm looking at those municipalities I mentioned before are part of this system, that's their system. Then what you do is, those municipalities pay into it. But other than that, take away the municipal boundaries, right? We're sharing the services amongst each other. So when one ambulance goes on a call, there's a second ambulance. Because each municipality, all right, based off of the revenue that's going to come in, again, it costs $1.3 million for one ALS ambulance, with the revenue available based off of billing, right? You're gonna pay for one ambulance, if that, and then what do you do when you have a second call, right? That ambulance goes on a call from Plattekill, goes over to Northwell and Poughkeepsie, and a second call drops. What are you doing, right? Right now, you're relying on other municipalities that are paying for multiple ambulances, right? So we're trying to get away from that. It's more equitable this way.
So how is it gonna be better that way, okay? Because it's basically, you're talking mutual aid, okay?
No, we're not.
Okay, that's why I'm.
So, example, say the system has 7 ambulances, right? You now have these 7 ambulances available, right? That's why I gave the example of what happened in the town of Lloyd back in March, right? You had a serious fire. Lloyd and New Paltz and Gardner are sharing ambulances. We had 3 ambulances available at that fire, right? You get a serious car accident out here on 32 at the intersection. What are we doing? How many you need 2-3 ambulances. Are they going to show up, right? Resources are spread thin, I mean, Plattekill, is doing pretty good with response, right? But when you take an incident that requires fire and EMS, right? What happens? Now he's stretching his system out. Modena is in the same predicament. They're stretching their system out, right? How long does it take? How long are you on task, right, with your ambulance to go to Boucher Hospital? Your volunteers are leaving their home for 3 hours. On their way back, a second call is dropping, right? And now they're going to pick that call up, right? And they're doing that at 3 o'clock in the morning, and now they got to go to work in the morning. And that's why we're seeing this drop in volunteerism, right? Because the demand on them is so much, right? It's a lot, and they can't handle it.
Can I ask you a question on this? I understand that the town, let's say, $100 per 100,000, okay? Now, there's a billing cost that people have insurance and some don't.
Yep.
Now, is that gonna be to help keep it down to that 100?
100, yes.
Because, or do we expect, is it the 100 because we have to start it now, okay? And then, in the future, because there's billing services, okay? Now, there's more money going into the pot. So are you saying that it will stay at 100 for a certain amount of time because you're gonna be getting reimbursed from insurance companies to be going into the pot?
Yeah, so.
And that's not just taxpayer, now you have
Yeah,
insurance
so,
involved.
so like I said, like, the system costs more than the $650,000
Okay.
that you're being, of your tax levy, right?
Okay.
It's more than that.
Yes.
Again, an ambulance costs $1.3 million.
Oh, no, I understand.
So the revenue from the Medicare, Medicaid, from the private insurance is what's offsetting that cost, right? So
Well, that's why I
we're
wanted you
looking,
to say it
yeah,
here,
yeah,
because-
and we're looking at the revenue of each municipality based off of billing, right? So we have really good data for Lloyd. We have really good data for New Paltz. We're getting better data over Gardner. We have some data, right, working with the Plattekill Fire District, which they don't do billing, right? But they've been doing a lot of research to estimate what that billing could be in this area, right? So we're using a lot of estimates. New Paltz Rescue has been providing backup coverage to the town of Plattekill, to the agencies in the town of Plattekill at no cost, right? On the backs of other municipal taxpayers. So they have some billing information. So we have an estimate right now.
Because that's what was
And that's-
lacking
and
in
that's- yeah.
in the presentation, you're saying 600,000, then you're talking about 1.5 million, but you weren't explaining to the
I'm sorry.
public that the billing process is gonna help defer the tax base.
Correct.
Okay,
But,
that's what
yeah,
I wanted to
but
make
yeah,
sure.
so if there was no billing, it would be more than 600,000.
Right, that's what
Right.
that's what I'm trying to say, because that question was asked.
I'm sorry that I didn't.
No, that
yeah.
question was asked, and there was a gap there that wasn't being answered.
But to your point, Mr. Council, this is a projection for what the billing revenue is gonna be.
Right.
Based upon data, which, you know, is as good as we can get, because we can't see into the future, we have to rely on historical data. But, you know, some people will say, and this is usually comes up at a hearing like this, is, well, if we're paying tax dollars for it, why am I gonna get a bill? Well, one, you have to get a bill for Medicare purposes, we can't not bill. And secondly, the bill actually, as the councilman pointed out, keeps the cost up to the taxpayer down. So you're gonna, if you pay, you may be paying a tax bill on January 2nd, if you need the ambulance on January 3rd, you're gonna get a bill for that, hopefully your insurance will pay for it, or if you're Medicare, it'll pay for most of it, you'll have to pay the copay. And if you're on Medicaid, the billing cost isn't even gonna cover the cost of the ambulance call, quite frankly, the Medicaid reimbursement is so bad. But the reason they have to bill is to keep that tax levy down. And that's why individuals who are gonna pay the tax are also gonna get a bill.
We call the $650,000, right, that paying into the system, we call it cost of readiness, right? Like, it's like paying your fire taxes. You're gonna have your fire department available to you, right, that they have the apparatus, they're gonna respond and so on. It's a cost of readiness. I think Director Miller wanted to try to say something.
Yeah, I agree. I'm Rich Miller, you said the director. In doing this, though, it's also important to recognize the fact, as Everett has said probably 2 or 3 times now, that it won't cover the entire cost. So through billing, you need to also consider that there are people within the town that don't have Medicare. They don't have Medicaid. They have no insurance whatsoever. But they will still get the same level of service, and then they won't be sent to collections. Nobody's gonna get sent to collections for the medical billing and the stuff that it is that goes on in the town. And if you look at it year over year, doing it with an ambulance district is a true hedge against increases if you were to go in the commercial route, which you have every right to do. I mean, New York is a home rule state. If you wanted to go out and get quotes from 80 different people that have CONs for this area, you can definitely do it. But the problem would be is year over year, if you're with a commercial provider, you're at the mercy, so to speak, of the commercial provider and whatever their expenses are year over year. We have sliced this information. Where is Doug? Doug, you know, you guys don't recognize the fact, but you have somebody here who really did a lot of his homework and set the framework for what it is that you're looking at. We are really confident, and it is an estimate, you know, to Mr. Hannigan's assertion, it is an estimate, but man, if we didn't hit the target, we definitely hit the tree. And Michael and I have been doing this for a long time. These numbers are gonna come in pretty close, and the first year, we're gonna hit it, and then year after year after year, you will have complete transparency in where your money is going. There isn't some corporate agenda somewhere, people that don't live in the state who are looking at this stuff, and through veils of bureaucracy, you'll never get a chance to see how much it truly costs. That's not the case here. What you are seeing is an investment by your community in providing this vital service to your community. We're growing our own EMTs right now in this county. We have a course sponsorship, Kelly's a part of it, you know, we're all moving forward, we've graduated 2 classes, we have EMTs that are entering the workforce now, and we're controlling that. Like we are now growing our own people, we're growing our own paramedics. So, to the commissioner's point, I think it's important to realize that no matter what it is that you do, and you know, Mr. Hannigan said this as well, is this is an inevitability. If you want an ambulance, you're going to have to go one way or the other. In my considered opinion, and I've been doing this for a long time, I would go this way, that's for sure.
And the one, just say one more thing, right? The other great thing about having an EMS district is that money is assigned to your EMS, right? It's not going into the town general fund. The town can't take it and say, oh, this is gonna go to the highway, this is gonna go to the PD, this is gonna go here. We're gonna start moving this money around. It becomes this shell game, right? This is for EMS. It's being used for EMS, and that's it. You know that that's what it's for, right? You know what you're getting out of it. Sorry.
Are there any other questions? State your name, please.
State
For
your
the
name,
record.
please.
State your name, please, Kat, for the record.
Me?
Yes.
Oh, I didn't.
I'm
Kathy?
calling on you, yes,
State your
so.
name.
I don't know. Dr. Catherine Blankupton. Mr. Hannigan, you live in or your office is in the town of Bethlehem.
Correct.
And is that the town that you had the experience with the ambulance?
I started out in a place called Lockport, which is out in western New
Okay.
York, and then I went to Olean to college and then to Albany. So yes, and some other places too.
Okay, that's my hometown.
Okay.
Town of Bethlehem, so I know
Okay,
it.
okay, all right.
And I have still in contact with a lot of people there,
Okay.
so I would be very interested to. I know other people who were involved in the ambulance service there. So I.
Well, up in
Interesting
several years ago, I was one of the first ambulance commissioners, but several years ago, we had 2 ambulance services. One through the fire department, one through the private agency. Consolidated those, and the town now is like this, town levies the tax. It contracts with a private, not-for-profit corporation, kind of like what's gonna happen here. I like to brag that when my town council people go to meetings, Association of Towns, they don't know what's going on because they hear us talk about ambulance problems. We don't have them there. We have 5 rigs on a day, 2 are paramedic rigs, 3 and it's supplemented with ALS provided by the county. So our town fathers and mothers have no idea what these problems are because we took care of this in 2004. So, I mean, ideally, that's I think what everybody wants, quality service, and then it's not gonna be a recurring issue. Other places, they can never get it off the agenda because they can't make decisions to move forward, so. But I appreciate, yes, my office is actually the original firehouse in town, so.
Excuse me.
Oh, okay.
People don't realize, for the public that is not involved with the fire, because as councilmen, sometimes we go to the installment billings, and there are people that answer, if there's 365 days, there's people that are answering fire calls as far as close to 500. So that means they're out there more than one call. And it's something that is needed, and yes, am I for it? 100%, okay? Because as a board, I feel we're responsible for the safety of the people in this town. And it's something that will be is to help everyone. We have seniors, we have everybody. Anybody could get hurt. I don't care if it's a toddler. And we have to have the response. And that's why we're here today. And I see most of the ordinances from the fire companies. Now, we have commissioners here. How do they feel about this? Because I know you're listening to the presentation. How does the commissioners feel?
There is two ladies here that wanted to
That's
ask some
okay.
questions.
Go
No,
ahead. Go ahead, Willie.
no, I wanna know, no, I wanna
Finish what you started.
know, how does the commissioners feel on this? Because we're the town board, but you guys are the ones that are out there.
So I'm Ray Paluzzi, I'm the chairman for the Board of Fire Commissioners for Clintondale Fire District. I have to tell you that on Sunday, my brother-in-law, who lives next door to me, had a cardiac arrest. I didn't realize that. I was out with a push mower cutting the lawn. And by the time I realized what was going on, my daughters had headed over to the house. They were starting compressions on him, and the ambulance was there about 3 minutes behind me. He's alive. I
Yes.
can tell you that the system that these gentlemen have engineered and put in place worked seamlessly. And it was not the only call in the district. It was like the third or fourth call in a row that had taken place. So this actually works. And I would encourage you to support these gentlemen. They're making the right decision on your behalf. And Sunday afternoon was a clear example of how well the system works. Because the guy's alive today as a result of that. So.
Thank you. You,
Yes.
go ahead, Mayor.
My name is Betty Gaston. I've lived in the town of Plattekill for 24 years now. And the question that I have, I missed the intro, but for the length of time that I've lived here, I've dialed 911 2 or 3 times. And usually, I think the fire department came once, a BLS and an advanced person. It was more than one ambulance that showed up. And I was wondering, maybe even the police officers also, why so many people come at one time. That's one thing. But I was just wondering in terms of numbers from last year, what has prompted, what has happened different recently outside of dialing 911 where that's not enough?
So I can speak to some of that, right? So when you dial 911, the dispatcher answers the phone, gets your information, and determines the call type, right? So it could be very rare, difficulty breathing, a cardiac arrest. It could be a bee sting, stub toe, all types of calls, right? But based on that call type, it's determined, is it a BLS call or is it an ALS call? Within the town of Plattekill, the agencies that respond here, it's all BLS response. The ALS responding, if it's an ALS call, we're going to dispatch ALS because you need it. The thing is, you don't pay for ALS. It's not being paid for. You're paying fire district taxes today, right? And I can tell you right now, and I'll let the chief commissioner confirm in the room, what you pay in fire district taxes and what gets appropriated to EMS is a very small portion, right? So that needs to be taken into consideration. So you're getting this additional service, ALS service, based off of the call type, right? So they're going to respond to help out. When it comes to law enforcement in most municipalities, very few don't have law enforcement on the road 24/7, right? They're handling, your different call types, whether it be a domestic, a car accident, but if they're not on anything, right, they're here to serve the public. So if you have a medical emergency, most of them are BLSFRs, they have some training, they're gonna show up to help you. That's why they do the job, right? So, but they're limited, the law enforcement is limited to what they can do, like, they're not gonna be able to transport to the hospital, they're one individual, so that's why you see ALS show up. It's based off the call type. We call it emergency medical dispatch. It's a national standard, right? They go through a questionnaire. They see what exactly happened, right? What's happening to the caller, and then they dispatch just a BLS ambulance, or they'll dispatch a BLS and ALS ambulance, right? And the ALS is there to assist the BLS. Now, if a BLS wasn't available, would an ALS suffice? Yes, but the municipalities within the town of Plattekill don't have an ALS service. Does that answer your question?
Yeah, but if I say, like this a week ago, someone at my home, he said he was having shortness of breath, and an advanced person was sent out, and a BLS ambulance also showed up. It didn't cost me any additional money, so I'm not understanding the money allotted 4.9 million, I don't know what that is, or the extra $100 per $100, whatever the home is worth, the extra money when it was sufficient to me dialing 911 and having someone come to the
Yeah.
home and take this guy to
So
the
do you,
hospital.
so I can tell you that the ALS ambulance that came to your home was paid for by a different municipality. The BLS ambulance that came to your home was paid through your tax. You live in the Modena Fire District or Platico Fire District?
Platico.
Okay, so you live in the Platico Fire District, right? So that BLS ambulance was paid through your fire district tax dollars. The ALS ambulance that responded, right, that's being paid for by a different municipality. The Platico Fire District, the town of Platico doesn't have an ALS service, right? So someone else paid for that ambulance for you.
Okay,
If there was even one available. So that was also a
Yes.
challenge at times as well, that the
And-
ALS is not always available.
And I want to say something, you were very fortunate to get all that response. I live 2.5 miles from Modena, and I had to wait for the ambulance to come from 17K. And then another time I had to wait for it to come from New Paltz. You were very fortunate. The fire companies try to do the best they possibly can.
and what town are you in?
I'm in Modena. It's a hamlet, you gotta understand, it's Platico, well, Platico is 5 hamlets. All right, that's what makes Platico, you got Clinton, you got Aldonia, you have all this, and it's one town. And that's what they're trying to express to you, that it's to cover the whole town. When it says Platico, that's the town, but there's hamlets. And that's covering everything. You live in Platico itself on the southern tier, right?
Close to, pizza place here. What is that, Dominico's?
Oh, down, yeah, okay, so, which is called Platico, but the rest of the town is called Platico too. There's hamlets, and we have 3 fire districts. So, just like they said about Clintondale, that New Paltz, I believe, covers them, if I'm not mistaken.
Today, right?
Today.
Yeah, today.
Today, I
So I'm just gonna, because you weren't here at the beginning, I'm gonna point this out. The town of Platico has 3 fire districts, okay? You have the Platico Fire District, you have the Modena Fire District, and you have the Clintondale Fire District. The Platico Fire District provides a BLS ambulance. The Modena Fire District provides a BLS ambulance, right? The Clintondale Fire District doesn't have an ambulance at all, so they don't provide any services, right? Besides BLSFR, where they respond with, a fire truck, right? And they have EMTs, but they can't transport you. So, but there's no ALS services, right? So what the proposal here is creating a district over the municipal bounded town municipal boundary, okay? Forgo the fire district municipal boundaries, just the town municipal boundaries, and you're gonna have the same level of service across the board. It'd be equitable for you living in Platico, for the councilman living in Modena, and for a resident living in Clintondale, right? So when you call and you have a difficulty breathing, right, you're going to ensure that you're receiving an ALS ambulance. Where when you called the other day for difficulty breathing, which is an ALS call, right, we the 911 center went and found an ALS ambulance from a different municipality to go assist the Platico Fire District that responded to your call. Now, it could be that that ambulance isn't available because if it's in another municipality on a call, you have no rights to it, right? Like, we were able to provide it. They said that they would respond and provide additional services, but it wasn't paid for by the municipality collectively, the town.
So again, what has changed, as far as
So you want to look at
us
time.
need-
So you want to look
in
at
terms
time
of
frames, right?
numbers,
So
in terms of numbers of-
Michael and Rich may have the numbers on the top of my head. Do you have the number on the top of your head? The response percentages for again, Clintondale is 0, right? There's no ambulance there, and I don't know if you can speak to Modena or Platico, but the chiefs are also here, so maybe they can
Yeah.
speak to that.
Yeah.
Please stand up and state your
Yeah,
name.
my name's Andrew Cross. I'm the current chief of the Modena Fire Department. When you say what has changed, this has been an ongoing issue that we've been having for close to 10 to 15 years now, with specifically the EMS. Us alone, I can't speak for Platico or Clintondale. Clintondale, obviously, they do their first response. Modena, we've steadily gone up EMS call-wise, strictly EMS call-wise, up to over 600 calls a year. year to year, and our response rate to those has gone down. The calls are going up and our response rate is going down. We, in the last 2 years, are down to, and I'm swallowing my pride to say it, but we're down to like 25% response rate. So that's 400 calls that we're not answering, which means they're going 3 dispatches for us, which is 15 minutes?
Yep.
Yes.
And then that's 15 minutes, and then we're waiting to call for another ambulance to come, hoping that they're gonna come, if it's a volunteer agency, whether it's Wallkill or Plattekill or what have you. This is kind of like the culmination of what we've been working for. Because we were down to, in Modena alone, we have 3 to 4 EMTs left, total. And we're gonna lose one because he's gonna be to the State Trooper Academy. So we're down to 2. So unfortunately, we can't provide the service that we're saying that we provide, basically, at this point. You're paying a fire tax, and your fire tax is EMS for Modena, okay, and for Plattekill. And in Modena's case, we're not providing the service that we're asking the money for. So we've been working with the county, our district has been doing a lot of homework, we've been working with the other fire districts to come to a solution, because as much as it's the town board's responsibility to protect the citizens of the town, it's also the fire departments too, right? The fire chiefs and the fire district. So we have to think of the best interests of the people that we're trying to protect, and this system that they're proposing to the town is, after meeting with the other fire districts and discussing all these numbers and everything, this is the best possible option, fiduciary, logistically, manpower-wise, to get everybody in the town, not just in Modena, but Plattekill and Clintondale, an ambulance in their driveway in a reasonable amount of time based on what they tell 911 when they call for an ambulance.
You have to also remember, people used to be in the area and employed. Many people, they're volunteers, but they might have a job that's an hour away. They're not gonna be responding. You don't have the amount of people staying in town. We used to be a farming community. The person would leave their tractor and go to the firehouse. But they're not here, as we progress, people are getting jobs far away. So that's why we have to go to paid to do this in order to protect the citizens of this town, okay, the residents, because it's not their fault they're an hour away, hour and a half away. It's not their fault, but when you get a call, you don't want to hear, well, he's an hour away, he's going to come pick up the ambulance, right? You want response. You were very fortunate to get a couple of response here, but I got to say, because I know Plattekill and some of Clintondale, they have some dedicated people that will go above, okay? And I'm not saying because they're here, but all these firemen, even Clintondale, all of them, I want to cover the whole town. They do a job, and they take it very seriously. And the same way they take it seriously, as a board, we want to protect our people, okay? And that's why I'm glad that they came here and I'm glad that you asked all these questions, because nobody wants to hear taxes going up. Basically, that's what a lot of people hear, taxes going up. But you know what? If somebody dies, nobody cares about the tax. Because they say, well, how come they weren't there? We're trying our best to get the town to have coverage. That's why I asked that the commissioners give they vocalize what's going on, right there, Mr. Croach, everyone, because we need it in the town. It's not something that, and I remember, I think, Bobby, about before COVID, somebody had waited for an ambulance to come from Middletown. It was an hour, okay? So this is not something that just happened. This has been progressively getting worse. And that's why I'm glad that they're here today to present this, because it's something that's needed. Listen, I know the seniors are gonna say, taxes, 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 but you know what? So you need the service. If your house is burning down, you're glad that they came over to put out the fire. So we have to have ambulance service, we have to have coverage, and we don't have it now.
How many new ambulances will we have?
I don't have that because I'm a councilman, right there. See how I passed the buck on that one?
So Rich will talk about the system.
What you're looking at is that New York is what's known as a home rule state, right? And that's been probably the biggest problem that we've had in overcoming the EMS dilemma, is that each municipality within itself, the highest elected official there, gets to decide who provides ambulance service. It's not an essential service though, so they don't have to provide ambulance service at all. But most choose to protect the residents of, their municipality. So when you talk about that, you're talking about the town of Plattekill being able to, through these 3 different fire districts, to say, Modina's gonna have an ambulance, Plattekill has 2, that is that they get out, and Clintondale doesn't have the ambulance at all within their fire district. So that's 3, 2 of which we're getting out, 1 of which now with Modena, through the chief's assertion, is really struggling to kind of get out. So you'll get probably 1 ambulance during the day to get out. With this system, what it is that we do is we take the surrounding municipalities, we combine all of that data and response time, geographic areas, how long it takes you to get to the hospital from the far reaches of it, and we figure out how many ambulances that it is that we need for a region. And those ambulances don't stay in your town. Those ambulances are constantly moving around, they're doing calls, they're going to the hospital as they're coming back across the river or from Kingston, they're being allocated to the areas that don't have an ambulance in them. So you would have in this area, there's 7. Not 1, not 2, but 7. And 5 of them are advanced life support, 2 of which are BLS. And with that constant movement of these ambulances coming around in an area, what that means is, to his point again, if the ambulance in your area goes out or they can't get out, instead of going 3 dispatches and then 15 minutes later you're trying to call a commercial service from far away to come, there's none of that now. If you look back a year and a half ago, there were wait times here, 45 minutes, an hour, for an ambulance to come from far away. How many times has that happened here in the last year? At all?
It doesn't happen.
It doesn't happen. And it doesn't happen because it's a system that's based off of data and it's based off of need. So when we look at it, it's not that it's not all municipalities pay the same because they don't have the same value, right? Like when you're in Plattekill, you guys did about 1,200 calls, last year. That's, wow, you need at least an ambulance 24 hours a day to 7 days a week to cover that kind of call. But then you need probably something during the day when it's really busy that's going to be in the area as well. And we take all of that stuff into consideration and we just, like I said, we keep those ambulances moving within there. So you would have access to not 1 or 2, but 7, really, depending on what's going on at that particular moment in time. Sure.
Is there anybody else that have any other questions?
You have to go to the chairman, please.
So
Anyone
who-
else?
Yeah,
do.
go ahead.
Go ahead, go ahead, right ahead.
I was
State your name, please.
Yes.
Catherine Archer. I was reading an article from last spring that Ulster County set aside $4.9 million for this project. Where did that money go to?
Yeah, so that is a resolution that was put forward by the legislature. And what we do with that money is it was twofold, and we developed it's called the EMS stabilization plan, right? And basically a lot of municipalities have been benefiting from that. So you got 2 pots of money. You got your first pot, which was $2 million, right? $2 million. And what we did was we dispersed that out to the BLS agencies, right? And that was to assist them with, they could spend that money on equipment, they could spend that money on personnel. and so on. So that would help boost them up because they were not receiving the appropriate funding through the tax levy. And then what we did with the other $2.7 million was we signed contracts with a few stronger ALS agencies, New Paltz Rescue, the City of Kingston, Woodstock the Woodstock Fire District has a paid ambulance service. We looked at Shandaken Ambulance, we looked at Diaz Ambulance, and we looked at Ellenville. And what we did is we started signing contracts with these agencies. We only ended up with 3. It was New Paltz, Kingston, and Woodstock. Yep, were the 3 that we ended up with, and we were paying them. So basically, what happened was, you still had your primary responsibility, right? So the agencies within the town had the primary responsibility of providing services, BLS as well as ALS. ALS is a responsibility. If you're going to take on the service, the appropriate service that's needed is up to the ALS level. So if ALS wasn't available, the county was subcontracting with these agencies to ensure that the service was being provided, right? That's not going away. Like, we are in the process of reevaluating the EMS stabilization plan from last year. Our contracts went into effect September of last year, right? So those contracts are coming up to an end, and we're going to look at how we disperse, that $4.7 million, going into the end of 26 and all of 27. Now, I just want to also is that funding is never guaranteed. Like, we do have the money for September of this year to reevaluate and reallocate, but that's always proposed in the budget. Within the resolution, there are a lot of whereases where that money can be pulled back, right? Like, so funding starts being pulled back from the federal government, and we need to balance that budget. That could be pulled back.
Okay, so none of that money is used to defray any of the expenses for any of the towns involved?
Yeah, so we are looking at that. That's part of our plan, right? So that's what happened, and that's out of that $2 million. So we are looking at that for 26, then the end of 26 into 27 is to try to offset those costs, right? And that is calculated in this, right? That there'd be a disbursement to the town of Plattekill to offset the cost. That's why it's $650. If it wasn't, if we didn't have that funding from the county, it would be more than $650.
So how much is being allocated?
Do you know off the top of your head what that allocation is?
For this next year.
I don't have the allocation off the top of my
Does
head.
anybody, do we have more questions from the public?
I have
Because I know we have a lot of firemen
Yeah,
here.
I do. I have a question as part of the
Yes.
public. I understand.
Please give your name.
State your name, please.
Sarah, and you'll get the rest of it when you get sued. So,
Oh, when I get sued?
Okay.
Okay.
my question is this. Why can't, I understand the need for EMS, I understand what you're saying, that people need ambulances and response times. My question is, why can't the money be pulled from the police department? You have a police department here that is completely ineffectual. I am a victim of my neighbor's violence that has been continuing for 6 weeks. I have called the police on numerous occasions. His dog has gotten off the leash and gone to kill my animals on numerous occasions. He has put racist content online.
We have to stay on.
Hold on. He has taken a photo of my face and AI'd it and making it as a couple and putting it online along with racist comments. And your police department has all that information.
That has nothing to do with this.
And I am still sitting here waiting for him to be arrested so that I can get a restraining order to protect myself and my daughter. So
Excuse
why-
me.
hold on.
No, excuse me. You're getting off track here.
I don't care.
Well, I do, because I'm running the meeting, not you.
Okay, that's fine. Why
Okay?
do I understand you need EMS? What I don't understand is why does the police...
Well, the police have nothing to do with this. We're not gonna discuss the
Why
police.
can't you pull the money from the
I'm not discussing the police. We're discussing
So let me
EMS
explain this
tonight.
for everyone in the
No,
room.
we have.
No.
Unless I get a restraining order, I'm suing the town
You-
and suing the police.
Okay, you
I
have,
will not have my pretty face, AI,
Look,
onto
all right.
someone else. That's
Okay.
a
Done.
cybercrime, and I've also
okay,
contacted the
stop.
FBI.
You're done.
No, you're done.
No, I'm not. You haven't seen me begin yet.
The entire town on the 4th of July.
Please,
exactly what
please leave,
stop.
leave.
Oh, I'm sorry. Are you a misogynist who doesn't care about a single disabled woman and a child? As you roll your
No.
eyes, put that on the camera.
Okay,
Have a good night.
Maybe we should
here's
save
my,
that
here's my
for
face, you wanna put it in the
public
camera?
Um,
not the ambulance
okay.
district.
Does anybody else have any other
About
questions?
this topic?
Excuse me?
She still wants
I- You're not, I'm sorry, you had something more to say?
I said I had a couple more questions,
Okay,
okay,
okay, fine.
unless somebody else wants to go ahead. I'm concerned that a lot of residents, before they get their tax bill, don't know what's going on. I picked up 8 packets, and 7 out of the 8 people that I shared those packets didn't know anything about this, her being one of them, at the meeting. You know, before our taxes get raised, should it go out to vote to the taxpayers?
Well, I think at this point, we really don't have a choice. And let's say it gets voted down, then what? We don't have an ambulance service? We're at the point now where this is something we need, this is something we have to do. You know, I know it's unfortunate, taxes are gonna go up, but I think the board would agree with me, it's a necessary evil. We're at a point now where we can't depend on volunteer services like what was already mentioned, because you don't have the volunteers anymore. So what are we gonna do? We cannot leave the town without an ambulance service.
You gotta
It
understand,
sounds like a
it's
great
in the
idea, don't
paper.
get me wrong, but, you know, with inflation 4% this year,
Well-
is it gonna be inflated?
Kathy, you gotta understand, we have a board there, and this is the same thing that happens to every public meeting that we have. Everyone says it wasn't out there. Well, the town people also have to make it their responsibility to look at the town, the postings, town paper, and when there's when there's on the board saying that we have a public hearing, you're here. And the only way other people are gonna be here, if you get the word out, because we try our best with 3 or 4 different places, but we're not out there saying, come. But we have a problem right now, and I believe the whole town board really feels for this. I can't speak for them, but I know I feel, because the lady right behind you, she's one of the top answering calls in Modena, okay? All of them really work very, very hard. I would never take that away from none of them. And if you wanna have coverage here, that's the price you have to pay.
If I could just add one thing. I think it's not even the we're already getting some coverage. You're just mentioning the equalization. This is one big point we have glazed over. So data, science, math, whatever the input is, you could see, and I'm sure the guys with all the data, could see how many ALS services have been sent from different towns to cover us in a need of urgency, where we have, in your case, let's use that for an example, you were fortunate you had them show up in an expeditious fashion, right? That came from another taxpayer's bill to cover your emergency. The equalization that we're mentioning here is, I won't say it's a fairness thing, it certainly doesn't seem fair, but what it is we're all trying to provide the benefit, the coverage to the seniors, the coverage to the towns and municipalities without having to wait, as Chief Croce has said earlier, you could be 45 minutes to an hour before something shows up. At that point, walk to the hospital. I mean, it's that bad. Go ahead, sir.
So I can just give you data to prove your point, right?
I'm just saying, yeah.
So when the call comes into the 911 center, 60% of the calls are end up being EMD'd as an ALS call. 60% of the calls we're required to send an ALS ambulance to, try to find an ALS ambulance. Now, obviously, you show up on scene, based off the evaluation of the EMT or paramedic, that could change, right? So we're seeing 40 to 50% of the calls are actually ALS. And again, there's no ALS service here.
So the other thing that he mentioned, which I don't know if everybody grasped, is this funding is only in place for 2026. There is nothing secured for 2027. What they're trying to do tonight with the fire districts and the town council is lay the framework to help secure secure funding for the year 2027. Because the county legislature has not definitely guaranteed the funding. That $4 million hasn't been really guaranteed to any agency or any town or the county residents for 2027. So if we don't have something in place to be functional for tax year 2027, you could be looking at no ambulance service and going back to over an hour wait. So that's why it's critically important that we look at what goes on tonight and make a move to get this in place for fiscal 2027. That's the underscore and the essence of why we're here tonight. No, and if you really look at it, you're looking at maybe $300 to $400 a year. I mean, I know that sounds like a lot, but if you go out to dinner, what's your cell phone bill? I mean, you look at what you spend your money on, and then you look at the fact that a circumstance like we had Sunday afternoon in our family, nobody was counting on the fact that this guy was going to have a cardiac arrest. But that isn't time on a Sunday afternoon to figure out I don't have an ambulance coming. So
Well,
you need to pre-plan.
Let me tell you this much. I'm just looking at people that have a single person paying all the bills, limited income, you know.
And once again, like he said, if you don't have the resources to pay for it, nobody gets a bill for it.
So let me ask you a question. Are there two fees? Is one for the ambulance to come and one gets billed to your medical coverage?
So you have, there's a cost of readiness. What's being proposed in your EMS district, what you're gonna be paying there, what your tax dollars are going to, is the cost of readiness, is to have the availability of the ambulance. There is billing associated with it. It offsets the cost, right? So there's two ways to do this, right? It's, the town can tax the district for the necessary resources, right? So you're going to be looking at over $1.3 million because you're gonna need, again, like, Director Miller said, you have 1,200 calls in the town of Plattekill, right? And that right there alone is one ambulance 24/7, 365. You're gonna have times where you're gonna have multiple calls into town, so you're gonna need a second ambulance, right? So you could pay for the entire thing outright, and you could be taxed for that, let's just call it, 2 ambulances at $2.6 million, or do you look at offsetting the cost with the revenue, right? So rather than the town collecting, having to tax everyone and then try to recoup the revenue themselves, what's being done is they would tax the town at $650,000, and then the revenue would be collected to offset the total cost of the system.
I would speculate that the revenue would be higher than the total cost, probably.
So what did you find what did we calculate for revenue for the town of Plattekill?
It's nowhere near it. I mean, the average.
It's below it?
Yeah, the average reimbursement, you guys are actually lucky in Plattekill. From Doug's research and also what we've got from New Paltz Rescue Squad, is a higher than expected commercial insurance involvement.
Mm-hmm.
You do have a significant Medicare and Medicaid percentage that it is.
Sure.
And that's also offset by no insurance at all. So your average reimbursement here is somewhere short of $700 a call for the calls that it is that you have.
Right.
Right? And basically what you would be looking at, and I can't remember off the top of my head, I think we were looking, what did we figure, Doug? It was somewhere in the, it was like
589.
No, it was, yeah.
589,000 was the projected revenue.
589.
For 2027.
Based on the call volume.
Rich, what's
It
the,
almost sounds like they're operating at a net loss, these
Who?
companies.
Well, so New
That's
Paltz.
the problem in EMS.
That's why they keep-
Let me just point out, right? So it's not a money making business, but I want to point something out here, right? Like, you're not dealing with a commercial agency.
Yeah.
You're dealing with Ulster County government agency
Yeah.
that is subcontracting out to a non-for-profit, right? So what we're doing right now, and also don't forget that we're sharing services, right? So you all have access to these ambulances. Again, like, there should be some type of cost savings there, that all these municipalities are coming together under one umbrella, Ulster County, and we're providing one shared service, right?
Right,
That's the
right.
whole concept of shared services, that we try to be conservative here. If you were going at this alone, you would not be paying $650,000.
I understand that, I know the math is a lot
Yeah.
higher, but I'm just saying it's like the private sector. If you're the ambulance guy turning the key to your
Yeah.
private business,
And
you're not operating
And
at
that's
that loss.
why some
You're looking for a
commercial
profit.
agencies have decided
Yes?
they don't wanna run the 911 calls, they
Yes
wanna
or
do
no?
the nursing home
I didn't hear your
transports and
question, I'm sorry.
transport.
I didn't hear your question.
I said, if you're running New Paltz Rescue, let's just say,
Yeah.
right, that's a private ambulance service.
Sure.
You're not doing that for non-for-profit.
It's a non-for-profit. New Paltz
But
Rescue.
non-for-profits make money. They don't
Sure.
do it
So,
for non.
so you have your
Non-profit.
650, you have your 650.
Right.
You have the allocation from the county that we're gonna be putting towards it,
Yeah.
right? You have your revenue of, 590, let's just call it 600,000. We're hitting that 1.3.
Correct, yeah. So that's, I
Okay.
guess that's where in my head, I was thinking there's gotta be some type of surplus revenue where whoever we're assigning the responsibilities to for ALS would be in that delta of making that money.
Yeah, but 1.3 is spread out of they know that, they got fuel costs, they got reinvestment, all that stuff
Correct,
is.
yes.
you know,
Tolls, tires, brakes,
Yeah,
all the insurance,
everything
the
is
carrying
included in that
costs.
1.3.
Yes, got it, yeah.
That's $150 an hour
For what,
for a year, for 365 days a year. $150 an hour, $1.3 million for ambulance coverage. But to your point, running a commercial service for a long time, in any urban dense environment within the Hudson Valley, you cannot make money. It costs you more money to do a Medicare or Medicaid call than, you don't get reimbursed enough. You're literally spending more money to do the call, but where you're making it up is transfer work, interfacility work.
Sure.
Then you get contracts in places that have 70% commercial insurance, and you're paying, and that's subsidizing the rest of it.
Correct,
And to
yeah.
your point earlier, basically here in the town of Plattekill, you're getting service from other taxpayers outside of this town.
Right.
Are there any other questions? You have one, Phil?
There's a gentleman in the back.
Oh,
Savage,
Rick,
Chief Clinton
yes.
Fire Department. Not to be sarcastic in any way, but if you kind of look at it, anybody could leave here tonight and have a medical emergency. And if we go back to 2023, where in my department, 90% of the calls are medical emergencies. 2023, I had a call on a Saturday afternoon in the spring. Couldn't find an ambulance. The county's trying to find an ambulance for me. I had nothing. Couldn't get a SOPIS, couldn't get a Gardner, couldn't anybody. Everybody was busy. The person actually got his oxygen tank, had his grandson bring him to the hospital because we couldn't do it. Okay? Same thing going back maybe the fall of that year. Finally, I was able to get a same call, difficulty breathing, got his cancer patient. Turns around, the only ambulance I could get at that point was out of a SOPIS, which was a 45-minute wait. I've also had a woman in seizures in Clintondale. Okay? Well, couldn't get an ambulance, and they sent me whoever comes, and you don't realize the severity of the calls because anybody here can have it. So you look at it, we're there and we're doing the best we can. And it's just, this is needed. This is really needed. The call, what does a human life cost? If you go down to dollars and cents, what does a human life cost?
Rick, you had a question?
Yeah, Rick Eisenhart, resident. I don't want to throw the fire department under the bus after she tried it with the police department.
Stay on point.
I'm on thin ice here. We already pay, part of our tax goes to the fire department. Easy now.
Easy, boy.
So a percentage of that tax is spent on pre-existing medical services, correct?
You would have to get them out.
Yeah, so I'll let the chief speak to how the EMS portion of their budget is broken down. I don't want to speak on their behalf, so I don't know if the chiefs want to.
Do we know that,
I'll take that one. So, Doug Foster, Chief of Plattekill Fire Department. So, as it was alluded to earlier, there's a very small percentage of that fire tax that's actually allocated to EMS. The significant cost in the provision of EMS, and specifically the transport service, is in that cost of readiness. So when we evaluated what the increase would be to the fire tax for us to be able to truly provide that service, it's almost 3 times what we're looking at by creating a special taxing district to be able to do that really in triplicate, because it's the Platicille Fire District, the Mobile Fire District, the Clinton Fire District that would all be pooling into that.
Right.
The way that we would have to hire staff to be able to do it, there's an additional cost there. And that's still not providing that ALS level of service. To specifically answer your question, for the Platicille Fire District, I can speak for, and I don't want to misspeak for anybody else. Out of the fire tax that's collected by us, there's just under $20,000 a year that's actually allocated to the provision of EMS to operate our 2 BLS ambulances.
Okay.
Our intent for that is, because I know the next question is going to be, why can't those little pockets be redistributed to support this endeavor? Our intent is to be able to respond to those critical to life and time calls and provide that BLS first response service. So when you look at data across the nation, the response times aren't really crucial until it comes down to those critical calls. So our intent is to put an EMT at that person's side within a 5-minute window, those life-saving couple first minutes, and then have that ALS transport resource available to be able to transport that patient to definitive care at that higher level of service. So we'll be working hand in hand, and those monies will be redistributed to that BLS first response component. And then, not to get off topic on the operational piece, ultimately, the cost is the cost, and the purpose for this conversation is the money has to come from somewhere.
You didn't put a time.
The best way that we could do it and working out the math is by creating that special taxing district. This way there's an equal share of the monies coming from the residents of the town as opposed to those individual pockets, like I alluded to earlier, where we're looking at almost triple the cost of being able to share that service. Hopefully that directly answers your question with a little bit of extra.
So you're gonna still send like a first aider if you want.
No, you're gonna get an EMT with full BLS
From the fire department
from the fire
until the
department.
ambulance gets there.
Yes, correct. Yes.
We're basically gonna bridge the gap where, like they were alluding to before, where it's the shared services model.
Okay.
So if we have, anybody here? No? Okay. If we have, it's a busy day in the Lloyd, Platicille, and Gardner area,
Right.
and there's 3 ambulances of those 7 that are dedicated to doing something, or they're coming back, where it's a ride back for them to get from, say, Vassar, right? It's 20 minutes to get back to around here. The fire departments are gonna show up with a pickup truck or a utility vehicle that has all that BLS stuff,
Right.
and we're going to bridge the gap time-wise to where we can provide life-saving measures for somebody that's in cardiac arrest until the ambulance gets there to actually put them and then get them to the hospital.
So they're gonna come as a fireman who's the EMT?
Correct.
Kind of, right?
Yep.
Okay, so you're not gonna be running ambulances or stocking ambulances or
Correct.
paying insurance on ambulances or putting tires on ambulance or spending gas
Yeah,
on
all that-
ambulances
all
and
that
stuff like that, right?
Ancillary stuff for maintenance-wise is going to go away.
Still sounds like a bit of a savings on a bit of a savings on here. Maybe not as much as I would think in my own
Right.
mind, but
Yeah.
it's a bit of a savings on. I mean, sometimes financial matters. If you can play the show game a little bit,
Oh,
you can
absolutely.
make it better for everybody, right? I mean, I don't think we do that really enough. I think we can do that a little bit more. But it's just a question.
No, I
But it
think-
doesn't go away.
Right, so it doesn't go away. So again, just to go back to that, and Mr. Hannigan kind of alluded to it earlier, we're not in the days of responding with the gentlemen in white suits and Cadillacs and throwing the body in the ambulance and transporting to the hospital. When you get an EMT from the fire department, you're getting a New York State certified EMT with all the BLS adjuncts, which is not just defibrillation, CPR. We're talking medications up to and including epinephrine. We have, the defibrillators. We have cardiac monitors. There's a lot that's being done at the BLS level to be able to sustain life-saving measures until that transport capability gets there. The other place where you're going to see that money translate over is, yes, we're not going to be purchasing an ambulance every 5 to 7 years, but we will be supplying some sort of a rescue truck type vehicle. So we're not putting a $1.4 million engine on the road. We'll put a $65,000, $70,000 pickup truck on the road to be able to respond to that emergency. To your point though, in year 1, probably not going to see that savings. In year 2, where we see this system and this model stabilize and see what those needs are, especially from the financial component from the fire district, yes, you'll probably see those savings and where those monies can either be reallocated to bolstering the fire response and our firematic services,
or potential savings in tax revenue. You know, and I don't think that anybody in this room is capable of speaking to that tonight, and again, in starting year one, because there are still other costs that we have to account for. Potentially one of the things that you'll see is not a significant increase in fire tax, because there's not that transport capable ambulance service to be able to support. Not saying that there won't be any, because just like everybody else is dealing with, the costs for us are increasing also. And as soon as you put, you know, tactical, fire response, whatever, it's an additional 11% increase over the traditional 2% increase, you know, as far as the cost goes year over year. But your point is valuable. And I think that, you know, we would be ignorant not to consider that. It is a consideration. It's just not something we're going to be able to do in year one.
Well, what about the $3 million or whatever they're worth of ambulances that we have sitting here right now? Like, what becomes of them? Because that was
Bridging the gap.
A pretty good expenditure.
Bridging the gap. So again, not to get lost in the operational component of it, because the purpose again of tonight is creating that taxing district so that the money is there to come from something. Speaking for Modena and Plattekill, our ambulances are at or past end of life.
Right.
So those, what was, you know, at one point in time, a $1.5 million investment, those are all due for replacement in the coming months, realistically. So although there was the intent to be replacing those vehicles, we wouldn't be. So, again, a cost that will get rolled over to the increase in costs of fire apparatus to be able to continue that replacement fund. But the intent in the immediate future is to be able to, as Mr. Paluzzi had referenced, is bridging again. So as this model stabilizes and we're able to put this taxing district together, those ambulances, and speaking only for Plattekill right now, those ambulances will remain available for the backup calls, for the structure fires, for the MCIs, for the special events in town, to be able to ensure that those ALS ambulances are response ready for the critical emergencies. We're also going to maintain those ambulances for our personal training, you know, as far as the fire department goes. So we're doing live fire training, we're doing bailout training, things that may result in injury to our firefighters. Those ambulances will be allocated to those, again, to allow those ALS resources to be available to the taxpayers of the town overall.
So you're still trying to live in both worlds here for a while, at least.
At least for a year.
Undetermined time. Well, you say that.
I think there's a transition period, right? I think that in anything we do, we have to transition. I think that's what the chief is trying to allude to, is that, you know, there's a transition period. You also, they own the ambulance right now, right? So it's there. If it gets busy, Fourth of July, busiest time of the year, right? Like, there's so many standbys right now going on. If we're gonna start taking those 7 ambulances that we're assigning, those are ambulances that are gonna be at the standby and not available. If the Plattekill Fire District that has that ambulance that's paid for sitting there, why not send them, that they're sending their fire department to do the standby because they're setting off fireworks, right? If they have the personnel, why not have them do the standby and manage any incident there in that localized area? Why try to grab one of those other resources that's going to be running around handling the call volume that already exists? Because just because you have that event, that one event, that's in surplus to your daily call volume, you know. So I think that's what you're looking at.
Well, excuse me, wait a minute. I'll take one more question from them. What I think we're going to do is close this part of it and keep the public hearing open for written comments for 2 weeks, so we could move on with the meeting. So,
Sorry, I
yeah.
do have a comment and question on a related issue.
Can you please state your name, please?
Sure, my name's Michael Hollick. I have a question, comment about an unrelated issue. I don't want to take time away from the EMS conversation.
So when we go into public input,
yeah.
that would be your best time.
Right.
Thank you so much.
Okay. All right, so we'll use the last question here.
In an ideal situation, as far as what you're trying to accomplish, with the amount of, because I didn't know Plattekill broken down into hamlets, I'm learning something new this evening. As far as all the homeowners and all of the district or towns or hamlets, whatever, collectively, the amount of money that is going to be, can I say raised each year based on the amount of homeowners who will be contributing whatever the amount of money is, according to what their house is worth, whatever. What is the projected amount that will be raised annually and what you need to do whatever it is that you're trying to do. I was just curious about that. How many homeowners, the amount that's going to be raised, and how much you will have to take care of the ambulance or whatever else you're trying to do.
I'll take a stab at that, okay? And that's in the materials that were circulated, but
Okay.
basically, what we're talking about, it's gonna cost, it's gonna, in the tax levy, the first year is gonna be $650,000. Collected equally across the entirety of the town, okay? And that's gonna result in an assessment of basically $98 for, 98 cents is gonna be the tax rate, 98 cents per thousand, or roughly $100 for every $100,000 of assessed value. It has to be done based upon assessed value. The law requires that these levies be done based upon assessed value, not any other metric. So those costs will be borne through that. Could they go up the following year? Yes. Could they go down? Yes. I'm not going to sit here and look in the eye and tell you I think costs are going to go down. I think that what you're doing is you're buying into a system that you need. Your EMS providers now are telling you need it. Okay, they're telling you they can't keep up. They're not keeping up with the demand, and they need it. And Ms. Gaston, you were extremely fortunate. Things went together nicely in the situation that you told us about. And you know, I think everybody who's an EMS provider went like that when you told your story, and because it doesn't always happen like that. And that's what we wanted to do is create a system where it does always happen like that, where you get the response you need timely. So, and that costs money because the biggest component of this is the provider, and the provider, we cannot rely upon volunteer providers any longer. The volunteers are telling you that. So I'm happy for your situation that came out, but I think one of the councilmen said you were probably the exception, not the rule. But you know, there's nothing worse than being an EMS provider and hearing on the radio that there's nobody coming, hearing those cones go out again, and knowing that you're out of town and you can't get there. That's the worst feeling in the world for those of us that do this job. It tears you up. It really does. So this system is designed to avoid that and to get around that. And yes, if there was a way to do it without costing money, I'd lay the plan out before you, but I can't. That doesn't happen.
All right, well, at this point, I'd like to close the public part of it, of conversation, of the hearing, and I'd like to make a motion to keep it open for written comments for 2 weeks.
Second.
Any discussion?
Nope.
On the vote? Aye. All right, so carried. Thank you, everyone, for your input. The minutes, we gotta do the minutes.
Thank you to everybody that came. Thank you.
Wanna do the minutes, Joe?
Excuse ourselves. Steve made a motion.
What?
I'm just saying, somebody make a motion.
Oh,
I make a motion to not read the minutes
second,
from the last meeting.
on the vote? Aye. You gentlemen,
Make a motion to approve the minutes from the last.
second? On the vote? Okay. Yeah, you have any additions? No? All right, at this time, you wanna take a break?
Thank you, dear.
All right, all right, then we're gonna take a 5-minute recess and
Everybody goes out.
stretch your legs, get a drink of water, go to the bathroom, whatever.
Okay, go ahead.
All right, next on the agenda is the Red, White, and Blue celebration. Just to remind everybody, it's next Saturday, July 11th, come around 5 o'clock.
Did you want to do public input for those couple people?
Oh, yeah, we skipped that. Okay, who's ever left here? Okay, all right. I'll make a motion, I'll make a motion to open the floor for public input at 8:31.
I will second that.
On the vote? Aye, okay. Go ahead, so you could restate your name and...
All right, thank you so much for your time. My name is Michael Hollick. This is my wife Lauren Hollick, Lottie Hill residents. We come today because we have a few questions and would like to voice our concerns regarding a logging operation occurring next to our property at the address of 442 Crescent Avenue. We've also brought a letter written by another resident who lives on the road and takes the logging operation.
Who couldn't make it tonight, asked us to pass it on to you, but I think you emailed it as well, but, you know, just to help you out.
So we just have a few questions regarding that logging operation for the committee.
Can I introduce myself a little more too?
Absolutely.
I wanted to say that we've been Ulster County residents and voters for 10 years, but living in Patagonia for 8, and we're born and raised in Dutchess County as well, so locals. I personally run an Ulster County workforce program where I get people apprenticeships and jobs in the trades too. So we're very active in the community and helping people out. So pretty much in May, the town of Plattekill posted a stop work order for logging happening at 442 Pleasant Avenue, the next door parcel that we're on, because they didn't have proper permits, and it's been paused, but we found out that they were going to start again up this week. Maybe they haven't started because of the heat wave, or we're not sure. So they're due to pick back up, and we are concerned about the logging and taking away the privacy of our home, because it is facing kind of where this logging is happening, our yard and our front door. And also just concerned about the wildlife and wetland areas that are on that kind of base of Illinois Mountain over there.
So main question to start with was that the parcel owner had a stop work order put in place due to not having the correct permits. Does the parcel owner now have the necessary permits required to continue the clear cutting? What permits were approved for that property?
Right now, we're waiting for the, either a letter, irrevocable letter of credit or a certified bank check for the bond.
Okay. My other question is that according to the SEQRA guidelines, usually in the case of clear cutting 10 plus acres, they would require a full environmental assessment. Did this board do an environmental assessment? Did you feel that was necessary or not?
No, I spoke to our town engineer yesterday about this, and no, he doesn't feel that you have to do a seeker on it, because usually what happens in the logging operation, they usually only use maybe about a half acre for a landing, where they stock the wood and then they load the wood to take it out. So he did not feel that exceeds that threshold.
This parcel owner doesn't live on the property, he just owns it, and he's trying to renovate a building that's on there to rent it out or sell, which is great. But he is out of money and is just logging pretty much the entire property just for the money.
Mm-hmm.
He's not doing it for the development or for the residents there either. And it goes right up against our parcel, which is concerning, but
So to touch
How
base,
large an area do you think?
15, it's 15.
15 acres. That's significant.
If you look at the Google Maps, like you can see what's being cut. It's like, it used to be an old growth forest, now it looks like the surface of the moon. And they've done a northwest section of the parcel and clear cut it and left it entirely barren and cratered and uprooted. And now they're working their way down the hill into wetlands, which are listed on the Ulster County parcel viewer. Well, that's kind of what we're coming to ask.
so we have a email from a Weston Mason, who's a wildlife biologist for the New York State DEC, stating that the work is being done outside of a known T&E zone, and the DEC is comfortable with it.
Yeah.
Known T&E zone?
TAZ, what was it?
T&E.
Threatened and endangered.
Yeah, threatened and endangered
Buffer
buffer
zone.
zone.
And the DEC are comfortable with that?
Yes.
Yeah.
Okay.
And his name is Weston Mason. WESTONMASON.
Okay,
And
thank
New
you.
Paltz?
Yes,
Right out of New Paltz.
And I'd also like to add that I also spoke to one of our building inspectors yesterday, and he said, excuse me, they weren't going anywhere near the wetland, because I guess they were the ones who issued the stop work order on originally, so.
Okay, so they're planning to avoid going into the wetland?
Correct.
Do you know if there's any sort of like buffer zone between the other properties that's been established? Because they had come out previously and marked trees essentially right next to our back door to take. No like 100 foot, no 500 foot, no privacy screen or anything like that.
Well, I know there's a 100-foot buffer zone from wetlands. I mean, as far as the property line, you know, as far as I know, you could probably cut right up to your property line, so.
There's wetlands on our parcel as well, so they might be stopping around there.
Okay.
As well. What else were we gonna say?
The other side of it too was that according to the DEC plot, the address connects to a disadvantaged community. Were there any discussions or plans put in place to handle potential pollution impacts to the community, such as like water runoff, such as the debris that they're leaving behind, air pollution, or noise pollution?
Because they will be working on weekends and holidays as well.
I mean, not to my knowledge, so.
My other thing is that in 2025, the town of New Paltz halted a similar development because it was going to harm their wetlands and salamander populations. Was that anything you guys considered or considered having reviewed in the case of this forest?
By an ecologist or something.
Well, if it was gonna be reviewed, it would have been reviewed by the planning board. If they had to go do any environmental, anything that goes in front of the planning board, it wouldn't come in front of the town board.
Okay.
When is the planning board, or I can just look that up on the website?
You said, what is the planning board?
When is there
When?
a planning board meeting?
Yeah, it's the second and fourth Tuesday of the month.
Right here at 7 o'clock.
Because we understand that parcel owners can do what they want with their property, but just with the privacy, and also like this is a really large section of trees that also have migratory birds that are nesting right now. Like we would feel more even comfortable with the logging if it was during, what is it, like October to March times where they can clear cut the forest when things aren't nesting. Because there are raptors and hummingbirds.
Hawks, and there used to be an eagle nest that they took down as well, under those trees.
Which we told the DEC and they double checked, and I'm kicking myself for not having a picture though, so I don't know what can be done about that.
Well, I guess that's something they would have to answer.
Yeah, with the DEC.
Mm-hmm.
It's been tricky, the DEC keeps sending us to the town board, and the town board keeps sending us to the DEC, so that's where we're like, oh, we'll come in person and.
Because if there's an eagle's nest,
There
they
was.
have a big buffer around that.
It's gone.
I can tell you that.
It's gone, it's on the top of their property.
Okay, so based off the conversation you had with the town engineer and the biologist, is that how you came to the decision to not pursue an EAF for this property?
Well, I mean, that's why I spoke to him, and he felt comfortable with it, so I don't know what else to tell you. I mean, that's one of the reasons I called him.
Okay. What was the town engineer's name?
Pat Hines.
Thank you so much, I really
He
appreciate it.
is not a PE in the state of New York, I'll tell you that right now.
He's what?
He is not a PE in the state of New York, I'll tell you that right now.
Okay.
He calls himself the engineer to the planning board.
All right, wait, let's
But he's not
let's
ready.
do one time, yeah.
Question to you.
Okay. I don't know that I have any other questions at this moment, except I'm gonna assume there was no conversation about like whether this was part of another development or if there was any forest management plan put in place.
Not that we know of. I
That
mean,
would be a question for the planning board.
Got it, so they would know if they're planning to expand anything, which is fine,
Yes,
but.
that question would be best at the planning board.
Our neighbor, well, I'll hand you his letter, but he talked to two inspectors from the town that came, and the inspectors said that they were, well, to him, I wasn't there, were appalled at what was going on, but they couldn't do anything and their hands were tied. So, I don't know what inspectors those were. And Stephen Bernstein is the resident.
The hours of work, this way you'll know, during the week is from 7 to 7 at night.
You know.
Monday through Friday. And then on weekends, it's 8 to 5.
Yeah.
For Saturday, Sunday, and legal holidays.
Especially as teachers and this being our time off, that's really difficult for us to enjoy our vacation.
Oh, I understand that,
Our
but
backyard and our garden.
because we've had other loggers, and that's why I'm saying it now,
Yeah.
because it says here hours of work, and you can't stop somebody from working as long as they're in this right here.
Absolutely.
I'm not trying to be difficult, I'm just trying to
No, I know you're not trying to be difficult. Thank you for reminding us what those were. It's just, we're here like, we don't
Yes.
really have the money to go somewhere for a month while they quickly
No,
clear
I
out their
understand.
acres, you know?
I guess I have a question for the board, and then I'll be pretty much done and satisfied, and I really do appreciate you guys giving us the time. With the biologists, is there a way, do I have to go to them, or is there a way through you guys to appeal that decision, to reopen that conversation?
You would have to go through DEC.
Through the DEC?
They want us to go to them.
Yeah.
They were like, go to your next town board meeting. Do you know what, I should have brought the list of all the people we chatted with at the DEC. Do you know what,
I know.
what's that called?
Well, this
What
is for the guy
office?
that's cutting it.
That I
DEC?
don't.
Well, you can go right here in New Paltz, is the regional office, so,
I've talked to a few people.
well, you could go there and they have biologists right there that you could talk to.
Is there a way we can get a copy of that email, or that decision?
You could foil it.
Okay, thank you so much, I do appreciate it.
I think we can do that to see what permits
Yep.
are there too.
All right.
Great.
That's it for me.
Thank you.
Thank you so much for your time.
Thank you.
Appreciate it.
Anyone else? Annette?
With the heat wave that's coming up, does the town have any cooling stations? When I was trying to look at Platicille, I ended up on Lloyd's website, and they have a banner saying what they're doing. Does the town do anything for people who?
So we opened up the town hall today as a cooling center. It was posted out on the town Facebook page.
Town Facebook.
Yep.
Yes. They add all those things, whether it's in the wintertime, something that, if it's too cold, it's town hall. We open it up. If it's too hot, it's town hall. That's the cooling station.
We'll make sure it goes out on the website too, but it was shared on the Platicille Facebook page.
Yeah.
It could be there. I potentially
Nope.
didn't see it, but I figured, let me ask so that you could answer, and if I ever get this thing to go online, people will know the answer.
Yeah, we opened town hall today as a cooling
And
station.
then what about,
It'll probably be open for the rest of the week except for Friday. Because Friday,
So-
town hall should be closed for the
Yeah.
holiday.
not open on Friday, not open on Saturday, and not open on Sunday?
It's supposed to cool off by Friday night, so.
I don't know.
That's what they say, who knows? We'll see.
If it keeps on going, we'll have to address it.
Yeah,
It does sound like a political thing.
I guess. Are there any other questions? Well, then, if not, I'll make a motion to close public input at 8:44
Second.
on the vote.
Aye.
Okay,
Willie,
next is,
wanna read that?
next is the email update. Gentlemen, you all got this, I'm sure?
Yep.
The estimates?
Yeah.
Okay, does anybody have any questions?
On the email?
Well, on the proposals,
No, but I'm good with moving forward with one of them.
okay, so am I.
I would assume that's the one that is.
This one right
that's
here.
Brian, right?
Correct.
Well, whatever, what's the name of his company? I guess that's it, Brian IT, right? Yes,
Alpha Tech.
Alpha, yeah.
okay.
Well, then, if you all had a chance to review it,
And everything's for the same numbers, right? Quantity 18, 18, 18, all the way across?
yeah, so, then I'll make a motion to go with, Alpha Tech with this, was it Dell M365 cloud solution provider, to, upgrade our system.
Second.
Any more discussion?
No, sir.
Well,
On the-
actually, only one question, and it's like, what account would this money be coming out of? Do we know? I mean, I'm sure it's there, but I'm just curious as to what account.
Off the top of my head, no, I don't, I'll ask the bookkeeper.
Okay.
Where were we? Oh, on the vote?
Aye.
Aye. Okay. Next. All right. Next, I guess, would be Patty. Yes, oh, there she is.
Good evening, and thank you very much for entertaining this on your agenda this evening on what was somewhat short notice. I am representing Minard Farms, who has a 4-lot subdivision located on South Street at 740 South Street. They're doing a subdivision which requires stormwater, which is obviously a requirement in a lot of subdivisions now. So we're before the board this evening to ask the board to consider adopting a resolution to accept the, approving the stormwater control facility maintenance agreement. It's been reviewed and approved by the planning board engineer, planning board attorney has reviewed it. This town board, I believe it was 2 years ago, approved one immediately to the north for the Parabelli property. So this is similar to that. Basically, the reason for it is that part of the subdivision, part of the DEC regulations, if you're gonna be disturbing more than an acre of land, you have to put stormwater improvements in place, and then they need to be maintained. It is the responsibility of the owner of the property to take care of that maintenance, but there is an agreement that needs to be filed with the county clerk that says that the town has the right to go into the property if the landowner is not taking care of it and holding the responsibility that they should. And if, so that's why so you have the right but not the obligation. And if you do need to go on the property and take care of it, I don't know, is it the town highway that does it, Bobby? Has that ever happened?
Yeah, I was gonna,
There's private ones.
that was the question I was gonna ask. Bobby, have you seen this and?
I have, it's gonna be private, Patty?
Yeah, this is the Dubrava one that we've been,
Sure, so I'm
got
assuming
approval over
it's
here.
not gonna be a
It's right.
town facility, it's gonna support
Correct.
the infrastructure of the subdivision, so
Yep.
it'll be privately maintained and inspected.
I guess my question was, have you ever had a situation where the developer didn't do what they were supposed to do and the town had to come in and take care of it?
Sure.
And then that gets assessed back?
I didn't say yes, I said sure. There were some subdivisions that fell through the, wayside in the past. I think the town has a better handle on them.
Yeah, actually, that hasn't happened in years, but the mechanism would be that then it's a taxing district, so any expenses that the town did incur to take care of it, in the unlikely event that that would happen, because of the controls that are put in place, it would not be a burden on the town, it would be assessed back to the taxing district, which is the landowner.
Well, I don't know how the rest of the board feels. I mean, my recommendation would be, since we just got this, if we could go through this and then make a vote at our next town board meeting with.
Oh, absolutely, I
Okay.
was not expecting.
Well, I didn't,
wanted to
I
be
don't know,
here.
I know.
Yeah.
Yeah, I know you,
Patty,
Patty.
you know when you bring it in, you want
I know you,
to vote right
Patty.
now.
No, that's, I said,
That's why you're on the agenda tonight.
I appreciated you putting me on the agenda on such short notice.
I know, I figured the next thing would be, to prove it, so,
No,
okay.
no, I'm not even gonna ask for that.
All right. Well, I figured before you do,
Don't do that.
so,
No, not even asking for it.
okay.
But I'm here in case you have any questions.
Well, she'll be back in 2 weeks.
I'll be back. Oh,
Well,
I'll be
that's
back
okay.
in 2 weeks.
In 2 weeks,
Sure.
in 2 weeks, I'm sure we'll be able to, I don't think it'll be a big deal, make a decision here. All right, so.
And then also, just so that you're aware, the other document that was provided in the packet was for the conservation easement that is going to be on the rest of the property. That doesn't need to be necessarily approved by the board, or, that doesn't get filed with the county, but included everything in the package so that you're aware. Because again, it gives the town the right to go on the property to make sure that the conservation easement is being maintained, but no obligation.
Okay.
Thank you, Patty.
Well, with that then, I'll make a motion that we'll review this and make a decision by our next meeting.
Second that.
And discussion, guys, on the vote? Aye. Okay,
And after you've had the opportunity to review it, if you have any questions, you all know how to get a hold of
we'll
us.
get a hold of you.
Thank you very much.
All right, thank you.
Thank you, Patty.
All right, what's next?
Refund.
Oh, a refund. Who's this? Okay, this is somebody that's asking for, we are requesting a $200, God bless you,
Sorry, I was.
of a deposited $400 check be returned to Greenacre Abstract LLC. They canceled the municipal search on the vacant land, and after I had already deposited the check, I attached the address that the check should be mailed to. And this is from Bill Jahowski. So what he's saying pretty much that we should return the $200.
200, right?
Correct.
I'll make a motion, we return the $200.
I'll second it. On the vote?
Aye.
I have a
Okay.
question on that vote. Was there any other actions done on it, or was just that he put it in?
No, I put in, that's it.
And that's it?
Yeah,
Okay.
so-
Oh, no, okay.
You wanna-
All right.
All right? Okay.
Yes, that's all right.
Okay,
All in favor?
we voted already, aye.
Okay. We had a question on it, and then.
Well, you, I know, but you didn't, so that's why I asked,
You
any
went fast.
discussion?
You went fast.
Well, we want to get out of here sometime tonight.
Yeah, before we get sued.
Yeah. The next is the auction for the detective car.
No, metal detecting at the park.
Oh, okay, I missed that one. Yeah, we got a request from Mary Alice and Terry. I guess they wanted to do metal detecting up at the park, and I understand our superintendent of highways told them it's not permitted. And personally, I don't think it's a good idea because of liability. I mean, if they're walking around tripping, whatever, so.
Well, it's not that. If you have a metal detector, you find something, you're gonna dig a hole and then cover
Right,
it back
but
up, which somebody walking could bloop and whatever.
Yeah, but then what are we gonna have, 50 people in metal
No, that's why
detectors
I'm
up there?
saying, no, it's not a good idea.
Okay, so I think with that, I'll make a motion to deny this, and also we'll send them, I'll put it in writing why we're denying it.
Second.
Maybe, and also the other thing maybe we should do is update the signage at the park. Something just broad coverage of.
No metal detector.
All right, well, we'll vote on that, and then we could address that, and you can paint it up, get a decal and put it on the bottom of the sign there. Okay, on the vote? Aye. All right. Now it's the car, the auctioning. Do you have information on that?
Well, we talked about auctioning off the detective car. Right now it's sitting in the garage. Cause it also has a broken back window.
Okay.
So we never finalized sending a letter to Mr. Wager to auction off the car, which is what we have to do.
Didn't you say there's a company that you've dealt with that?
AAR we used,
Okay,
but we still gotta give him directive
okay,
to auction
that's
it off,
fine,
so
but I know, I remember
we
you.
never did that, so.
All right,
So I'll make a motion, we give
the highway superintendent.
Highway Superintendent Wager the letter to auction off the car.
I'll second it.
On the vote?
Aye.
All right, well, I didn't have to say any more discussion. On the vote, aye, okay. Okay, Bobby, get rid of the car. But you gotta split the money with us, though. No.
I didn't say that.
Well, I'm just kidding. All right, next. This is filming request, police department. Okay, here's a letter from a production company that's going to be filming in Plattekill for an upcoming Netflix television series, The God of the Wood, The God of the Woods. They're eager to work with the town of Plattekill and to ensure a safe, organized, mutual beneficial production process. They are requesting a temporary street closure of Huckleberry Turnpike between Route 32 and East Road with the assistance of the Plattekill Police Department. The proposed schedule for this closure is as follows. The date's Thursday, July 9th, and hours of operation from 9 a.m. to 5 p.m., and the rain date is July 10th. They're going to coordinate directly with the police department, with Chief Lopez, to arrange for hired off-duty officers to manage intermediate traffic control as required. During these hours, a designated area will be used to film during scenes of our hero car attached to a tow rig. 3 picture cars, 2 cars will follow our hero car. 1 car will pass by in the opposite direction, and 2 follow vans of essential crew members to film the scene. We will rent out a large parking area nearby to use as our base camp and staging area. Our production company carries a comprehensive general liability insurance policy with a limit of $1 million, $2 million upon approval. We will gladly provide a certificate of insurance naming the town of Plattekill and its officers as additional insured. We appreciate your time and consideration of this request. I welcome the opportunity to discuss further any questions, provide additional information, and they have Audrey, how do you say her name? Loria? So, you can
The
contact
highway
her.
superintendent had something about that.
Okay.
Just consider that Ulster County is closing East Road on that same date. There are
For the culvert.
county-approved detours. Huckleberry Turnpike is not the approved detour, but I'm assuming it will be used pretty heavily.
So I did ask the same question. They're gonna alternate the lane, so they're only gonna use one side of the lane. Because I had the same exact question for the same exact reason.
Because I've been using it because I don't want to go on 32.
Just clarification, Councilman Hoppus, that the alternating lane, so they're gonna utilize one lane of
They're gonna use
Huckleberry
one
Turnpike?
lane of a 1.5 lane road.
Okay.
Of Huckleberry
So
Turnpike.
that lends itself to an even more important piece, if I may.
Go right ahead, Doug.
The question as far as egress and ingress, and specifically related to emergency response into Huckleberry Turnpike, also with consideration of the East Road project through the county. Obviously, the response to the other side of East Road is already going to be extended for us in emergency response. I have concern about what that's going to look like and if there will be an implication to us, or if there will be some sort of provision for emergency vehicles to be able to get through Huckleberry Turnpike during this filming.
Well, you're good.
Well,
Covering the bases.
I agree with Doug.
Okay, then.
I'm not, yeah, and I'm not saying don't do it, I just, you know, if a 1.5 lane road is going to be reduced by potentially a full lane, regardless of if it's gonna be alternated or not, we're not going to get emergency vehicles through Huckleberry Turnpike. Again, not saying don't do it, there just needs to be some sort of a ability and communication, thank you, between the filming crew, whoever's doing traffic control, and then just, you know, unfortunately, in the unlikely, hopefully, event that we do need to get emergency vehicles through, they'll have to stop filming and do their cut again. And just as long as there's an
Maybe,
understanding of
maybe
that, and
the
work with
chief
us.
would have to go.
Well, that, and I think I can call him too and also talk to the chief and.
Well, the priority would be first responders.
Right.
And then filming.
Yeah.
Right, but I wanna let them know that what he just brought up is an issue.
So that's what I'm saying, so if.
And I'm happy to be part of that conversation, you know, if it's helpful and beneficial, I think it's definitely important that we bring outside into the town of Plattekill. It's very important to support that, obviously it's a great opportunity for us.
Yep.
Not looking to prohibit that or impede that at all, so I'm happy to support it and be part of the conversation.
I just think
It's
there
just a
needs to
legitimate
be
question.
a contingency plan so you gotta send somebody up there, get off the road, like whatever that contingency
Yeah,
plan.
you gotta shut down
Yeah.
because we gotta go
Right.
through.
So this is why they want to use the police department as their fire police to maintain the traffic. So if there is an emergency, PD will know about it before we even make Huckleberry Turnpike to start.
So I guess the
So they can have
stipulation
it shut down before we even touch Huckleberry.
So the stipulation of that would be is that the provision there was that it was going to be off-duty officers moonlighting in that capacity. I don't know as though they would have the ability to have that communication
That's right,
directly.
the communication.
They're still going to have their radios.
Okay.
Let's just ensure
Okay,
that, let's just make sure.
But we will
I'm
confirm
happy to be
with
part of the
Chief
conversation.
Lopez.
Everybody, yeah, 100%. I just don't want to see anybody not get a service because, you know.
Right, no, it makes sense.
You got it, Doug.
So just with those provisions, we'll amend it, but I think we're.
Yeah, we're good.
Amendable to moving forward with it, just gotta make sure the.
All right.
First responders can get up there.
So go ahead.
And the police chief and everything, they're good with whatever they're getting paid, right? It's covering all the costs.
Yeah, they're gonna cover,
No
well,
cost to the
then,
town at all.
you want me to put that in motion to contact the chief, or just, you want me to do
Just
it?
gotta do it.
Or okay, and I'll call these people too. All right, resignation letter.
Well, you gotta make a motion to give permission to.
I know, but I'm just wondering, before we give them permission.
Well, we
to
don't
talk-
have a meeting till after they're filming.
All right. Okay.
So you just have to have those provisions.
As long as
Agreed
Chief
upon.
Lopez is on board,
And I'll even go as far as say, please don't not move forward with that motion on what I brought up. And
I'm gonna make a motion, we
Okay.
grant them permission.
I'll second it.
All right, then, on the vote?
Aye.
Okay, I'll do it then. Next is a, letter of resignation. Huh?
No, yeah, that's right.
To the town board, planning board, zoning board. Okay, this is from Elizabeth Ackerley. Please accept the letter as formal notice of my resignation from my position as planning and zoning clerk in town of Plattekill. My last day of employment will be June 19th. After careful consideration, I have decided to pursue opportunities that better align with my professional values and long-term goals. I appreciate the experience I have gained during my time with the town and will do best to assist with a smooth transition during my remaining time. Thank you for the opportunity to serve the town and its residents. Liz Ackerley. Okay, what's this here?
I'll make a motion to accept.
I'll second it.
All right, on the vote? Aye.
What if we say no? Is she coming back?
You know she ain't gonna come back.
Okay.
Well, just, so what's it left? Executive
Just
session?
have executive session.
All right, somebody want to make a motion?
Make a motion, we go into executive session.
Second.
A second for personnel.
Yeah, does Bob want, Bob, do you want to discuss in executive session the money transfers?
Wait.
There was something that wasn't moved.
If you want, I can pop in for a minute.
Yeah.
I would appreciate that.
I would appreciate it because this way it comes right to me.
All right. So, we got time. Motion to come out of executive session at 10:02.
I'll second it.
Second.
A vote? Aye. Okay.
During executive session, we discussed the chairman of the zoning board. At this time, we feel that we are gonna remove Chris Mercier as chairman of the board of the zoning board. And I'll make that a motion.
I'll second it.
On the vote?
Roll call, do a roll call vote.
All right.
Roll call. Steve?
Aye.
Willie?
Aye.
Mike?
No.
James?
Aye.
Aye.
Okay.
All right. I guess next is what, vouchers?
Yep.
Okay. I'll make a motion to approve vouchers. The A General Fund in the amount of $21,777.15. The DA Highway Fund in the amount of $217,791.16 for a grand total of $239,568.31.
Second that.
Okay, on the vote?
Aye.
All right, good. If there's nothing
Make a
else,
motion to adjourn.
I'll second it.
Aye.
On the vote? Aye.
Aye.
So the meeting ends at 10:04. All right.